Good afternoon, everyone. Doc Dave here with episode number 40. And it's on a very common disorder, and a lot of people think about this, and it's at this time of the year is the most prevalent. It's tick-borne diseases. And what is a tick-borne disease? Well, it's an infectious transmitted disease through tick bites caused either by bacteria, viral, or parasitic disorders. Now, there's many different types of tick bites that are somewhat concerning, but the most common and the most concerning to a certain degree is Lyme's disease. Now, there's other disorders, tularemia, deer tick, Rocky Mountain, so forth, and we won't cover them all because it's too laborious. But the most common one, Lyme's disease, I'm going to go over in quite detail. So, what is Lyme disease? It's not a virus or a parasite, it's a bacterial infection. And the ticks, they feed on a rodent or a deer, and they absorb the blood from that vector, and then they latch onto a human and they spread this bacteria into the system of the human host now. And so that's kind of the transmission process. And what are the symptoms you get from it? I mean, there's a lot of information out there. Some's good, some's very confusing, but the symptoms are basically fever and chills. This usually comes on around 36 hours after you've had the bite if you didn't remove the tick. So it looks like a little mosquito bite. It's got a little bleb to it. You may or may not see the retained tick. The tick could be a baby tick, which is so small you don't even see it or notice it, but it's there under the bleb. Now, big mature ticks are easier to see. They're usually dark in color, and they're head first into the skin. And their legs may still be moving around. So the fever and chills, you get headaches like migraines, you get extreme fatigue, you get arthralgias and myalgias, so you get joint pain and muscle pain. You get lymphangitis, which is swelling of the lymph nodes, which is quite painful. And, those are usually the early stages. And we're going to go through all the stages. There's actually 3 stages, but that's kind of the presenting stage 1. That's the most common one that people start off with. And what are the most common areas that you get tick disease? Well, upper Midwest and Northeast and Mid-Atlantic. Lyme's disease comes from a city or region in Connecticut called Lyme, Connecticut. And that's where the disease was originally diagnosed, and so the name was given from the town in Connecticut where the disease was found. Where do they live? Well, they live in grassy, brushy, and wooded areas. And usually in the spring, but it can happen in the summer and fall as well. And, you're walking on a path, you brush up against some grass, and boom, it's on the tip of the grass, and it attaches to you, usually in the legs, or especially if have uncovered legs, you're just hiking with shorts on, or on the feet if you have open-toed shoes or sandals, which is not recommended. And we'll go over the prevention later, but that's where they usually hook onto. They can hook onto your arms if it's tall grass and you brush with your arms as well, or onto your clothing and then crawl around and get into your skin. So that's how they usually come on. Now, so what I mentioned earlier was stage 1, all of those complaints and symptoms that you have. Now, what is stage 2? Now, stage 2 comes on when you don't have any treatment, or you haven't found the tick, and it just bores in there for days and days. And then you can go from stage 1 to stage 2. And that usually happens 3 to 10 weeks after the bite. Now, the symptoms here is you get a spreading of a rash, and the rash with tick disease is quite diagnostic. It's a kind of a red raised rash, and it has a clear center that looks white, and it's called a target sign. It looks just like a target. If you ever seen the emblem of Target markets, that's what it looks like. White in the middle, red around the outside. So if you see that, you're a little bit behind, the 8 ball as far as treating this. So you get also in stage 2, you get neck pain and stiffness, which is very uncomfortable. You get facial motor weakness on either one side or the other or both sides of the face because it can get into the facial nerve. You get arrhythmias in your heart because the disorder affects the myocardium, your heart muscle, and the electrical transmission that controls your heartbeat. You can get pain in the back and hips that spread to the lower legs, which is also very uncomfortable, to say the least. And you can get pain and numbness and weakness in the hands and feet. And you can get painful swollen eyelids and decreased visual acuity, so it'll actually affect your vision. So, needless to say, you want to try to prevent this disease. And if you do get it, you got to get into it and figure it out within 24 hours, because after 36 hours, it's in your system. Now, there's also a stage 3, which is really rare. It's generally found in Europe on different types of ticks. And it's large big joint arthritis amongst everything else that I mentioned, and pain and swelling. So the key here is to remove the tick within 24 hours. So you gotta find it, you gotta look careful, you gotta prevent it, which we're gonna go over in a few minutes, and you got about a 24-hour clock once that thing bites you to get it out of your system, and then, you're generally pretty safe. If you're walking, you come home from a hike, you see it on your leg, I'll explain to you how to remove it later, but if you get it removed, in a few hours, then you're generally okay, unless you have an altered immune system, of course. So after 36 hours, it's generally too late. You got we got antibiotics, and you got to be watched closely by your physician. So speaking of physicians, when do you see a doctor? You're not going to go see a doctor or go to the emergency room or the clinic every time you get bit by a tick. Well, the early diagnosis can prevent the symptoms and promote the treatment. So again, that 24-hour clock, don't forget that. Now, if it's after 24 hours and you start developing symptoms, that stage 1 part that I talked about, fever, chills, fatigue, arthritis, this, that, type of the other, then you got to go see your doctor. And he can treat it with an antibiotic. There's an antibiotic called doxycycline. And it's 100 milligram, 1 pill, that's it, boom. The compliance is 100%. You don't have to take 3 pills a day for 10 days. You take 1 pill, and it's generally quite effective. So, how do you prevent it? This is the kind of disease that you want to prevent, because this disease can be with you for a lifetime. So prevention, a lot of it's common sense, but we're going to go over it all anyway. So, obviously try to avoid tick bites when you're outdoors. Ticks attach mostly to the lower legs and the feet. So how do you prevent it? Okay, number 1, use tick repellent. Something with at least 0.5% of something called permethrin. Okay, and you'll see that on the bottle. And, if you apply that to your legs, your feet, your arms, you're generally going to be pretty good shape. You'll also, if it comes in a spray, which it does, you can spray your clothing, your shoes, your tent if you're camping outdoors. And it goes by the commercial name of DEET, D-E-E-T. We've all heard of that. You don't put it on your face, but you can put it everywhere else. Number 2, dress for protection. So now you've applied, the repellent. How do you dress for protection? This is, pretty complete, but, I'm going to go over it anyway. Light colored clothing so that you can see the tick if it gets on your clothing. If you're wearing black or dark clothing, you're not going to see the tick. So wear light clothing if you can, so you'll notice them. Avoid open-toed shoes and sandals. That's pretty common sense. Wear long-sleeve shirts and long-sleeve pants. The shirt should tuck into the pants, and the pants should tuck into the socks. That's how you're completely covered then. Now you say, well, that's a lot of work. But if you prevent disease, it's worth it. Number 3, check for tick bites. Do the tick check after you've been outdoors hiking or whatever. First thing you do when you get home, most people do it anyways, take a shower after your hike and look at your body as you're showering. Make sure that there's, no ticks that you're noticing. Use a mirror on places in your anatomy that are difficult to see, i.e., under your arms, your hair or your hairline, your ears, your wrist, between your legs, between your toes, behind your knees, and even in your belly button. There you go. Now you check all those areas, you're generally 99% clear that you don't have a tick on you. And this is important, and most of us know this, but don't forget this. Check your dog, because you'll notice these on your dog. Your dog doesn't follow the path as well as we do. He runs in the bushes. He maybe chases a squirrel or a lizard. He'll get ticks on him, or she'll get ticks on her. And, if you got a light-colored dog with relatively short hair, you'll be able to see him pretty easily. What I usually do is lay my dog down, roll him over, look at his belly, look between his legs, look under his arms, take the collar off, look under the collar, look behind the ears. So you got to check your dog, because not only will it jump from your dog to you possibly, but it'll get on your car seat. It can get on the sofa at home when your dog comes up and cuddles next to you to watch TV at night, on your bed. If your dog sleeps on your bed, those little creatures will crawl off the dog into your bed and onto you. Number 5, check your hiking gear. Look at wash all your outdoor clothes when you're done in hot water and hot dry cycle. Don't reuse the clothes again. Don't throw them in the hamper, because if there's ticks in there, they'll spread all the other clothes. Now, and the last one, most common sense, number 6, is stay on an open path. Don't get off path where you're going to be in the bush, wooded area, or grassy area. So, there you go. And here's the last thing, but maybe the most important thing, is how do you remove a tick if you get one? So you get home, you look, you see you got it on your arm. Okay, it's in a relatively easy place to get off. So you use fine tip tweezers, and you get as close to the skin as possible, because the head is burrowed into the skin, and if you pull it from the back above the skin, you'll break the head off, you'll get the tick out, but the head's in there, and the head is where the bacteria is, in the jaws and in the saliva. So you want to get as close to the skin as possible. Steady, firm pressure. Don't jerk it out. Don't turn it one way or the other. Don't light it with a match or put mineral oil on it. None of those things really work. So just steady, firm, linear pressure. And once you get it out, you wash the area with soap and water to remove any bacteria. Pour a little alcohol on it, septic alcohol, and that'll kill any of the bacteria that may have remained on the skin after you've removed the tick. There you go. So that's basically it. That's good information, very educational, and about tick bites. Everybody thinks about it. Everybody gets outdoors. Everybody hikes, goes camping, this, that, or the other. Now you know what to look for, you know what symptoms to look for, you know how to prevent it, you know how to treat it if you go to your doctor, you know how to remove it. So hopefully you enjoyed this, and that, this is something, again, to share with your friends and family, because, anybody can pick it up. And trust me, you remember these stage 1, 2, and 3s. You don't want any of those disorders. So thank you for your time today, and subscribe so you'll be notified when I have another great episode coming up that's very practical and easy to understand. And hit the like button if you liked it. So I will see you soon.